So good afternoon everybody. Today we will be discussing some drugs which will be acting on the skin and mucous membrane. How many of you used this drugs on the face? Medicines for the face? Someone who has not used? No one, no? Everyone uses. So which is your brands? Fair and Lovely, all of you. Nivea. Okay, so there are so many brands of the creams which you use. So which one was lotion, which one was emollient, which of them was lotion? Did you notice which is lotion, which is cream? So today we will be learning something about these things. Drugs used in skin and mucous membrane. So skin, you know, we have this epidermis layer, dermis layer, subcutaneous layer. So there are some diseases which can be associated with this epidermis. Then there are some deep-seated disease which can be affecting the dermis part, and there are sweat glands here. So most of the infections are associated with this sweat glands, blocking of the sweat glands. All these things are there. So hair follicle associated diseases are also seen. Okay, so the drugs which are used here will act on this skin and mucous membrane. Sometimes till the dermal layer we use such drugs. So the agents are like demulcents. Okay, these demulcents are the substances which are used topically, are inert substances which soothe the inflamed denudated mucosa or skin by preventing the contact with air, irritants and the surroundings. So these contents will be a part of your preparations, maybe creams, lotions. Okay. So licorice, methyl cellulose, propylene glycol, glycerin. So glycerin is part of most of the face wash which you use. So emollients are again the soothing agents where to use to soften and soothe the rough skin, dry skin, and increase the absorbability of the topical medication. Cold cream preparations, okay, which are used for rough skin, patched skin, all these things we use the emollients. So what are these emollients? These are olive oil, sesame oil, cocoa butter and liquid paraffin. Nowadays they combine this calamine lotion plus liquid paraffin plus aloe vera for topical application. How do you apply it? Apply it as necessary and after bathing and washing the face on the affected areas. So adsorbent and protectives, they are finely powdered, inert and insoluble solids capable of binding to the surface. These agents are magnesium stearate, zinc stearate, okay, magnesium silicate. So talcum powders, they contain these things. Okay, so calamine lotion is there, which is universal lactocalamine lotion. Most of the people use it for the skin agents. The calamine lotion, the plus point is they blend with the skin color because of the presence of ferric oxide which can blend with it. Starch is used, boric acid again it forms a part of this. Aloe vera, the costlier face creams which contain this aloe vera. Polyvinyl polymers are also used. Astringents are basically protective agents which precipitate the surface proteins, okay, and protect the underlying tissues. So they are used in eczemas where the vesicular or draining lesions are present. Chronic itchy lesions with discharge and all, we call them as eczemas. Okay. And for this purpose we can use this white vinegar or acetic acid 5%, and for pseudomonas infections, Burroughs solution, potassium permanganate. This pink colored solution, have you seen potassium permanganate? So it was used initially as a patch. It used to give bad color to the lesions, but still it was used. Potassium permanganate previously was used to purify water. Okay, it was always used to be a part of this travelers where they used to keep this potassium permanganate for wound. If there is a wound, they can apply on the wound. If they want to purify the water, they can use this 2 or 3 crystals Okay, it is one of the important agent, antibacterial agent by oxidative effect. Tannic acid, it forms the preparation. It is also present in our tea. Okay, common tea what we drink. Zinc, it forms now an important part of all the topical preparations using calamine lotion. It contains zinc, and now vulgaris contains zinc. Zinc is part of most of the preparations here. So creams and ointments, which is used for what purpose? Okay, we need to remember we use them interchangeably like creams, ointments, lotions, but exactly what they are, where we are using them. Okay, which is better you can see. So creams are less greasy, but ointments are more having petroleum base, so more greasy. So creams can easily blend with the face, but ointments, if we use on the face, it can give a oily tinge. Okay, application is more easy, creams, but for ointments there will be oily feeling. So work well on the interstitials and the hairy areas, and it can be drying and having cooling effect and easy to wash off. Less greasy and so easy to wash off. But here ointments we can use it for wounds, completely dry skin where we need oily substance there to prevent the further exposure of the wound to the watery surface. So alleviates the dryness, prevents evaporation, removes the scales, enables medication to penetrate the skin and stay there for longer time. It is a water repellent, so greasy base, water repellent, so it will stay there for longer time, difficult to remove. Remains on the skin for longer time. It again has this soothing and lubricating effect. Lotions relatively to cream are more water soluble and more watery preparations and less viscous than cream. So irritants and counter irritants, these are usually based on this counter irritation principle, like deep seated pain, arthralgias, myalgias. For example, you apply Jandu balm, all types of balms you apply, Amrutanjan, all these belong to this irritant and counter irritant groups. Iodex, all these are these groups. So they stimulate the sensory and nerve endings and induce inflammation at the superficial, so the deeper pain is reduced. Lubrifications, again irritation, hyperemia, sensory stimulation, all is there. Vesicants, strong irritation, hyperemia they can cause, capillary permeability is increased and thereby they decrease the pain. Okay, vesicants, lubrifications, counter irritants, all these are superficial irritants and relieve the deeper pain. So we have volatile oils such as turpentine oil, clove oil, eucalyptus oil, camphor, menthol, mustard seeds, capsicum, cantharidin, methyl salicylate or oil of wintergreen, alcohol. All these agents can be used as counter irritants. We have caustics and steroids. So here these are rarely used for specific purpose. These are corrosive agents, silver nitrate, trichloroacetic acid. They are used for skin tags are there, dark marks are there. They use chemical cautery in the skin OPDs. They use these agents. Okay, it is like using burning agents to remove the dark spots or marks. They use this in skin department. Keratolytic agent. For example, the skin becomes very hard because we can see it on the heels. Okay, so what happens in the cold seasons? Our heels become cracked. So we need to use a keratolytic agent where the burden of skin is removed and new skin will come faster. So the common agent is salicylic acid, lactic acid, urea and sulfur content. So what these agents do? These are the substances that dissolve the intercellular cementing substances and cause peeling of the superficial layer of the skin. So it is used for treatment of warts. Okay, they tell in Kannada Ane. Okay, that is what is warts. Okay, bones, callus. In the callus they form thickened lesions on the heels. Okay, on heel side where we can use this keratolytic agent. Severe cirrhosis we can use this. So urea is hygroscopic agent and can be used along with steroid. Benzoyl peroxide we use in acne. Okay, acne dark spot are there. We need to remove that dark spot. We use this benzoyl peroxide, and they also act as a comedolatic agents. have you heard this dandruff? Okay, that's what we call it as seborrheic dermatitis. It can be seen in the hair and nape of the neck, all these areas it can be there. For seborrheic dermatitis, we can use this ketoconazole shampoos, okay, imidazole antifungals, oral drugs are also available, and along with that we can use this selenium sulfide, zinc, pyrithione, corticosteroids are used, sulfur, coal tar, all these preparations are used for this seborrhea. So melanizing agents, for example, there is decrease in the pigmentation. There can be white patches, vitiligo, where we can go for this increasing pigmentation, increasing sensitivity to the solar radiation. Have you heard of vitiligo? White spots? Yes? Okay. So there will be some white patches, no? Some people will be completely white, something like a complete field of skin like that appearance. That is vitiligo, which can occur in the pressure areas, and also it is genetic, hereditary is also there. Okay, white patches, face and body parts. So we can use the psoralen, methoxsalen, trioxazole. Nowadays they are trying this tacrolimus, immunomodulator preparations are also available. So psoriasis, have you heard of this condition? Yes? Psoriasis is a condition where the skin turnover is very rapid and the patient will have lot of peeling defect. So for psoriasis we can use the agents which can remove the scales and have soothing effect for the patient. Itching is again one more important thing we need to prevent there. Okay. So for psoriasis we can use this vitamin D3 preparations, that is calcipotriol, suppression of the epidermal proliferation, tazarotene, synthetic retinoid, again retinoids will help in removing of the scales, coal tar agents and exert phototoxic actions can be there, and chemotherapy, photochemotherapy, that is UV radiations we are using, what we call it as PUA therapy. Acitradine, again synthetic retinoid, etanercept and methotrexate. Methotrexate, you know, it is a immunomodulating agent. Etanercept, again it is a immunomodulator, it will be helpful in psoriasis. So coal tar preparations, do you remember this petroleum preparations? The final degradation product will be this coal tar preparations. Okay, so what they use for making road, have you seen? How do you prepare? How do you make the roads? What is that black thing? Tar. Okay, see, these are the final distilled products. Okay, first we will get this petroleum jelly, next petrol, diesel, all these things are there. The final end product will be this coal tar. Okay, so from these also final products they can be used for treatment on the skin. These are this Tegrin cream and lotion. This coal tar preparation we can use for this psoriasis. Psori gel is there, polytar, Tegrin soaps containing these coal tar preparations are there. We can use them in psoriasis, seborrhea and eczema. So where we cannot use this coal tar preparation, if they are causing hypersensitivity reaction, if there is broken skin, genital, rectal area, we should be careful. Okay, and high concentrations they can be dangerous. So we got to know the melanizing agents included with steroids, but demelanizing agents also we should know. Because when the skin, if there is a dark spot on the skin, if there is a burn on the skin, so there will be what there will be on the skin, there will be a dark spot after burns or after wound, after acne which you have scarred for a long time. What will happen? A dark spot will be there. So in order to remove this, we need to use a demelanizing agents. Those are this hydroquinone and azelaic acid and monomethylene preparations. So sunscreens, to prevention of this solar burns and all. So the girls or the women, what they use, to prevent the sun rays from falling on the skin, they use umbrellas if there is lot of shady thing is there. So once the skin is exposed to this UV rays, what happens? There will be dark tanning of the skin. Okay, tanning of the skin or darkening of the skin will be there. So in order to prevent this, we can use this umbrellas or also the topical applications which can reflect back this UV radiation from the sun. So for UV radiations to prevent, we have physical preparations and also chemical preparations. These agents which protect the skin from the UV rays prevent from photoaging and phototoxicity. UVB screens, that is paraaminobenzoic acid preparations, cinnamate, salicylate, benzophenols. These are again can act as a screens. So have anyone used the sunscreen lotions, sunscreen protectors? Have you heard of it? So everyone is using. So sunban from Ranbaxy, they will be costing around 300, 400. They are costly things, but they are effective in preventing this sunban. So you can see there on the preparations, UVA screens are avobenzene, oxybenzene, zinc oxide. All these preparations, if you read that, these are the primary contents. So those agents which can reflect this UV rays are petroleum jelly, zinc oxide, calamine lotion. All these can also be protective. So drugs for acne. Acne vulgaris is the most common thing what you see. Have anyone not experienced this acne? No one, no? Everyone has experienced this acne. You know acne what it is? Yes? What do you see in the face? Acne vulgaris. Acne. Everyone has got treatment, no? No? You know Modwe? Modwe Bakala? Okay. So acne, for acne we use this benzoic peroxide, which can be converted to benzoic acid, which has antibacterial, comedolatic and catalytic action. So retinoic acid, this is again vitamin A preparation where it increases the skin turnover and brings about the newer skin, decreases the pigmentation. So it can reduce this hyperkeratinization and has comedolatic effect. Okay, and comedonal formation is prevented. Adapalene, it is again retinoic acid preparation which can increase the skin turnover. Adapalene, isotretinoin, all these are vitamin A preparations, and isotretinoin is used orally and it is highly teratogenic drug which cannot be used in pregnancies. So topical antibiotics, we use clindamycin creams. Clindamycin creams, you know, Clindac. So azelaic acid, again one more topical antibiotic obtained from Phytosporium ovale, inhibits both aerobic and anaerobic organisms, and it can also be used for melasma. And some systemic therapies are used including doxycycline, clindamycin, clarithromycin. All these systemic therapies are available. So steroids, they form most important content of the skin treatments. Any skin lesions, they are using one or the other steroid preparation. So these are, what are the preparations? Commonly they use this hydrocortisone, betamethasone, and for bindi, for what they put kumkum, there will be dark spot after 10 years, 20 years of application. After that they use this to prevent this dark spot formation at the place. We use mometasone creams. All these are there. Commonly we use this steroid preparation for fungal infections, Tinea corporis, Tinea pluralis, Tinea inguinum involving the nails. In all these conditions we use this steroid creams. So other medications, just for completion purpose. So anti-inflammatory hydrocortisone creams are there, anti-pruritic calamine lotion, calatril, both are calamine preparations. Burrow solutions are there, Benadryl, diphenhydramine, which is preventing itching. That's why we can use these drugs.